situations. That's why, for example, many people, as we know, have seizures, right? Epilepsy, attacks of epilepsy, when full moon is known to accompany. And I'm just giving kind of a crude example. So if we say due to food allergy, it's one thing, but if we say, hey, why do you have food? I basically won't even ask the question, food allergy, unless someone has severe illness, bouts of illness like severe migraines, headache, really suffers because being allergic to that food, and we have to address eliminating that food for the time being. Okay? Or he has a bad seizure or bad asthma, life-threatening situation. I wouldn't even bother asking if you have food allergies or not food allergies. Right? I would just go for the cause of food allergies. And the causes of food allergies: parasitic infections, worms, smaller parasites, definitely yeast infections, deficiency of good bacterial flora imbalance, mercury in the gut, mercury in the intestine. These are your main causes of allergies, like food allergies. So again, we put food allergies in the thing, so yeah, that's the answer. I will put parasites here, or mercury, or probiotics, say, oh, this is better answer. After that, the patient starts rejecting food allergy as the answer. Okay, and we find that technique as an AET is completely senseless and needless. Or anything else that balances allergy. So even allergy desensitization technique, whether you use conventional allergy shots or if you want to use homeopathic drops, so what? You're correcting something that doesn't have high meaning. Yes, go ahead.
I have so many patients with type 2 diabetes, high blood pressure, and cardiovascular disease, which usually translates to atherosclerosis. I was just hoping you could talk a little on the etiology of, is it also heavy metals that interferes with all of those things? Causes the
it is not
pathology.
To say that diabetes and heart disease are a product of atherosclerosis.
No, I mean...
It is to say that the common causes of all of these things.
That's what I'm interested in hearing.
Yeah, it's like to say that cholesterol causes heart disease. How do you know that causes heart disease? Have you rolled out other reasons causes heart disease? And if people do have high cholesterol, the question is, and they have heart disease, high cholesterol and heart disease are symptoms of, let's say, mercury or pesticide sitting in your liver, okay, that leads to overproduction of cholesterol. So here you're doing the same thing that many people do in alternative medicine. You're trying to explain symptom with a symptom. You're trying to explain atherosclerosis through cholesterol, where both atherosclerosis and cholesterol are victims of underlying toxicological agents.
Okay, that was one of my big questions. So right. Atherosclerosis is from toxicological...
heavy metals.
Heavy metals.
Yeah, and you have to determine which arteries. Some people coronary arteries, some people carotid arteries, leg arteries, etc. And this is a big part of FCT.
See, that's a revelation.
And how you address one part without shifting the problem to another part.